Hi everyone, good morning. Welcome to one more session of Q&A discussion by Samson Medlin Academy. We will go to the questions each. First question, which antibody is involved in allergy caused by wearing necklace? Which antibody is involved in allergy caused by wearing necklace? Options IgA, IgD, both A and B, none of the above. Answer is option D, none of the above. Okay, so in this question, it is asked about allergy caused by wearing necklace. Okay, necklace is a jewelry item. Okay, so sometimes the jewelry items, the presence of certain elements in the jewelry items can cause allergy. Okay, a best example is the presence of element nickel. Okay, nickel itself is not able to induce any allergy because it is acting like a hapten. It is acting like a haptens. So do you know what is hapten? Hapten, these are small molecular weight compounds. They're not able to induce any immunological reactions. But when they combine with the certain proteins in our body, then they will act as antigen to trigger the immunological reactions. So the presence of nickel is actually responsible for causing the allergy. Now, we have studied about different type of hypersensitivity reactions, right? There are mainly 4 types of hypersensitivity reactions: type 1, type 2, type 3, and type 4. Okay, so in this table, you can see the type 1 anaphylactic reactions. It is mainly caused by the antibody IgE. Okay, it is mainly due to the release of a chemical known as histamine. Then type 2, it is due to the antibodies IgM and IgG. Again, type 3 reactions are mainly due to IgG antibodies. And finally, type 4. Okay, so type 4 is otherwise known as the delayed or cell-mediated hypersensitivity reactions. It is not mediated by any of the antibodies. Okay, it is cell mediated. So you know that the immunological reactions are mainly carried out by either B cells or T cells. Okay, and these antibodies like IgE, IgD, IgM, or IgG, all these antibodies are derived from this B cells, whereas T cells is responsible for this cell-mediated hypersensitivity reactions. So in this question, the allergy which is caused by the jewelry items is actually an example for type 4 or delayed or cell-mediated hypersensitivity reactions. We can say it is a type of allergic contact dermatitis. So it is not mediated by any of the antibodies. It is not mediated by any of the antibodies. It is purely a type 4 and it is mediated by the T cells. So that is why the options, in the given options, you can see IgA, IgD is given, then both A and B. So it is not mediated by any of the antibodies. That is why option D, none of the above, is the correct answer. Okay. Now let's go to the next question. Which of the following statements is not correct regarding friability test? Okay, which of the following statements is not correct regarding the friability test? So options: hardness and resistance to friability are necessary for tablets to withstand the mechanical shocks of manufacture, packaging, and shipping. Then friability is the tendency of the tablet to crumble. Friability is measured using tablet hardness testers. None of the above. So answer is option C, friability is measured using tablet hardness testers. So this is the incorrect statement out of these 4 options. Okay, so now let us review this question. So the question is asked about the friability test. So friability test, we know that it is one of the quality control tests for tablets, right? So tablets, once it is formulated, we will we will make it undergo lot of QC tests, right? Hardness, friability tests, content uniformity, disintegration, dissolution. So these are the different type of quality control tests which are done for tablets. Now, this hardness and friability test, these are almost linked together, we can say. It is actually determining the strength of the tablet. So if a tablet is hard enough, or if a tablet is more hard, we can say it is less friable. Friability means, or friable means, the ability to break down is actually meant by the term friability. So if the tablet is hard enough, then it will not easily undergo breakdown, or it will not easily undergo a friable situation. So hardness and resistance to friability, these are necessary for tablets to withstand the mechanical shocks of manufacture, packaging and the shipping. So definitely the tablet should have enough hardness and resistance to friability, because once it is formulated, it has to move from multiple locations for packaging, then for shipping. So in all these situations, it can undergo different type of mechanical shocks or physical shocks. So there is a chance that if the tablet is not hard enough, it can undergo friable. So definitely the first statement is correct. Next, friability is the tendency of the tablet to crumple. Okay, that statement is also correct. Now, friability is measured using tablet hardness testers. So it is not measured using tablet hardness testers. Tablet hardness tester is actually used for measuring the hardness of the tablet. Okay, friability is entirely a different phenomenon. So friability is measured using different type of friabiliters. So that is why in these options, option C is the correct answer. The question asked is, which is the following statement is not correct. So that is why option C is correct here. So let us look into the solution also. Tablet hardness testers measure the degree of force required to break a tablet. Friabiliters measure the friability by allowing the tablet to roll and fall within a rotating tumbling apparatus. So hardness, friability. Hardness is measured using hardness testers. Friability is measured using a friabiliters or a rotating tumbling apparatus. Both are different types of test. Now, next question. Patient has abnormal BUN value and renal failure. The GFR rate is given, that is 25 ml per minute per 1.73 meter square. Which drug is contraindicated? Options: cephalosporins, meropenem, metformin, piperacillin. Correct answer is option C, metformin. Okay. You know that this blood urea nitrogen, it is a renal function indicating test. We are carrying out that test to assess the renal status of a patient. So in this question, already it is given the patient is having abnormal BUN value, and already renal insufficiency problem is that the creatinine value is recorded as 25 ml per minute, right? So it is less than 30 ml per minute. So GFR rate is usually calculated to assess the renal status of the patient. That is also one more test apart from the blood urea nitrogen. So metformin, you know that it is a anti-diabetic agent. Okay, metformin is usually contraindicated in renal failure or renal dysfunction, especially when the GFR rate is less than 30 ml per minute. Okay, and why it is contraindicated? Because there is a risk of lactic acidosis. That is why it is contraindicated. There are also other drugs like corticosteroids, fluoroquinolones that can elevate the blood urea nitrogen value. Now let us go to other options. One of the other option was meropenem. We know that meropenem is coming under the class of carbapenems, right? Carbapenems, we are studying it under which class? under the cell wall synthesis inhibitors. Okay. So under the carbapenem comes the meropenem, imipenem. Okay. So in the case of imipenem, we have studied that it is a nephrotoxic drug. But when we combine it with cilastatin, we can protect the drug from causing the nephrotoxicity. But in the case of meropenem, it has an excellent safety profile and it can be used in the elderly as well as renally impaired patients because it is not causing any sort of nephrotoxic reactions. Then piperacillin tazobactam, it is available as a combination. It is a penicillin antibiotic that is not associated with the nephrotoxicity, and it is usually been prescribed in the case of acute kidney injury, combining with vancomycin. So out of all the options given above, the metformin is the correct answer. It is contraindicated in renal failure. Okay. Let's move to the next question. Which vitamin deficiency is predominant in patients undergoing gastrorectal surgery? Vitamin C, vitamin B1, vitamin B12, vitamin B9. Which vitamin deficiency is predominant in patients undergoing gastrorectal surgery? Answer is option C, vitamin B12. Okay, so you know that there are different type of gastrorectal surgeries there. Okay, esophagectomy, Roix and white turtle. Okay, so there are different types of gastrorectal surgeries are there. In general, it will affect nutrient deficiencies. Okay, vitamins, minerals. So all these nutrient deficiencies can happen for in a gastrorectal surgery. And usually it is corrected by providing the supplementation. But here we are going to see which vitamin is more affected by a gastrorectal. Vitamin deficiency is more happening in the case of gastrorectal surgery. It is found that vitamin B12 deficiency is more relevant, that is associated with the gastrorectal surgery. You can see it in the case of esophagectomy as well as in the case of Roxanne white turtle gastrectomy. Now, you know that in the case of vitamin B12, for its proper absorption into the body, it requires the presence of gastric acid and also it requires the presence of intrinsic factor. Okay. Now, for a patient undergoing this gastrorectal surgery, there will be reduction in the gastric acid production and also there is a reduction in the availability of this intrinsic factor. That is why the vitamin B12 deficiency is more affected. And in such patients, we need to give a lifelong management with this vitamin B12 supplements, either through the oral route or through the parenteral route. Now, vitamins A, D, E, K. What sort of vitamins are they? They are fat soluble vitamins. So, especially surgical procedures like ROX and Y, they can significantly affect these deficiencies, but we can correct it by using the supplements. Now, vitamin B1, in the case of vitamin B1, the deficiency, the level of deficiency depends upon the patient condition. Okay, so it is more prominent if the patient is having severe vomiting or severely reduced oral intake. Otherwise, the vitamin B1 deficiency is not relevant compared to vitamin B12. Now, folate deficiency, it is less common than vitamin B12 deficiency due to its absorption across the entire part of the small intestine. So, out of all the vitamins, fat soluble vitamins, water soluble vitamins, we can say that vitamin B12 is most affected by this gastrorectal surgery. Coming to the next question. Which is the most effective treatment in allergic rhinitis? Which is the most effective treatment in allergic rhinitis? Options: phenylephrine, cromolyn, budesonide, chlorpheniramine. Correct answer is option C, budesonide. Okay, so you might be familiar with these drugs in the case of allergic rhinitis. So almost all these drugs you can use, except this chlorpheniramine, you can use in the case of allergic rhinitis. What is chlorpheniramine? It is a first generation antihistamine. Okay, it is a first generation antihistamine. So apart from the chlorpheniramine, there is diphenhydramine. These are not usually preferred in the case of allergic rhinitis because there are a lot of problems associated with the first generation antihistamines like sedation, okay, and anticholinergic effects are there. That is why preferably second generation antihistamines are more preferable in the case of allergic rhinitis. And in this case, the next option given was budesonide, which is available in the intranasal form. We know that budesonide is a corticosteroid. So usually that is considered as the most effective medicine for the treatment of allergic rhinitis. Okay. And next is about the phenylephrine. What is phenylephrine? It is a alpha adrenergic agonist. Okay. We have studied about the different alpha and beta actions, right? So in the alpha receptor itself, there is alpha 1 and alpha 2. So alpha 1 is responsible for causing this vasoconstriction, right? So because of the vasoconstriction action, this phenylephrine, it can cause nasal decongestion. That is why it is used as a nasal decongestant in the allergic rhinitis. But in the case of phenylephrine, there is a problem. We cannot use it for more than 3 days because there is a chance of rebound nasal congestion. That is why it is we cannot consider it as a most effective medicine in the case of allergic rhinitis. We can use that. It is also a medicine used in allergic rhinitis, but it is not the effective medicine. Okay, because of the problem of rebound nasal congestion. Now, next is intranasal cromolyn. It is also useful in the case of allergic rhinitis, but before contact with an allergen. So that means it can be used as a prophylaxis. Okay. But if an allergic rhinitis has already happened, then this is not effective. So that is why the most effective medicine for the treatment of allergic rhinitis is intranasal corticosteroid. So the option budesonide is the correct answer here. Coming to the next question. Which herbal drug is associated with pseudoaldoststeronism? Which herbal drug is associated with pseudoaldoststeronism? Options: digitalis, licorice, ginkgo biloba, and ginseng. So correct answer is option B, licorice. Okay. So the question is asked about aldosteronism or pseudoaldoststeronism. Okay. We know that what is aldosterone? Aldosterone, we know that it is a mineralocorticoid. Okay, it is a mineralocorticoid that is released from the adrenal gland, right? Now, this aldosterone, what is the function or what is the action of this aldosterone? It is responsible for causing sodium fluid retention in the body. Okay, so this aldosterone will help to retain the sodium and water within the body. That is the action of this aldosterone or this mineralocorticoid. Okay, now similar to aldosterone, there is cortisol is also present in our body. Okay, now cortisol is also having similar action as that of the aldosterone. Okay, cortisol is also having similar actions as that of the aldosterone. Now we know that aldosterone is acting or it is causing the sodium fluid retention by binding to mineralocorticoid receptor. Okay. Similarly, cortisol can also bind to this mineralocorticoid receptor and produce an aldosterone-like effect. Okay. Now, when we compare the presence of cortisol and aldosterone in our body, cortisol is actually present in more concentration than aldosterone. Okay, cortisol is almost present like 100 times more concentration than aldosterone. So when the cortisol is present, it can also stimulate, okay, or we can say it can overstimulate this mineralocorticoid receptor. Now, there is one enzyme which is present in our body. In the nephron, there is one enzyme present, that is 11 beta HSD2 enzyme. Do you know what is the function of this enzyme? This enzyme is responsible for the conversion of cortisol to cortisone. Okay, it is responsible for the conversion of cortisol to cortisone. Okay, now this cortisone, it is not able to bind to the mineralocorticoid receptor. Okay, it will basically, you can say, it can inactivate this mineralocorticoid receptor. So once it is not able to bind to the mineralocorticoid receptor, it cannot cause this sodium water retention. So now we are talking about the cortisone. Okay, how the cortisone is formed? It is formed from cortisol, okay, in the presence of this 11 beta HSD2 enzyme. Now, what is the relevance of licorice? Okay, we know that the licorice consists of different types of chemical constituents like glyceric acid, glyceric acid. Now, this glyceric acid, which is present in licorice, it can inhibit this enzyme. Okay, 11 beta HSD2 enzyme. What will happen when it inhibit this enzyme? When this enzyme is inhibited, the conversion of cortisol to cortisone will not happen. So, who is predominant now in the blood? That is cortisol. So, we have just now studied that the cortisol, it can stimulate this mineralocorticoid receptor, right? It is present in more concentration than aldosterone. It can overstimulate the mineralocorticoid receptor. So, when there is overstimulation of mineralocorticoid receptor, there will be more sodium and water retention will happen. So that effect is known as pseudoaldosteronism or pseudo hyperaldosteronism. Okay, that is why the answer for this question is licorice. All the other drugs mentioned above, they are not able to induce an aldosterone effect. So let's go through the solution once for your easy understanding. So licorice, it is usually used as a flavoring agent and it is FDA approved also. And glyceric acid is the active principle which is present in the licorice extract, which is approved by the US FDA. Apart from the flavoring agent use, it has wide therapeutic usage like as an anti-cancer, anti-inflammatory, antioxidation, antiviral, and antibacterial properties are there. Excessive consumption can lead to hypermineralocorticoidism by the inhibition of the enzyme 11 beta hydroxysteroid dehydrogenase. Okay, this is the full form of that enzyme. Now, in the by inhibition of this enzyme by glyceric acid. So, glyceric acid is actually a metabolite of glyceric acid, which is causing the inhibition of this enzyme. Now, 11 beta HSD enzyme is its function is to convert cortisol to cortisone. Okay, once the cortisone is formed, it can inactivate the mineralocorticoid properties since cortisone cannot bind to the mineralocorticoid receptors. The inhibition of 11 beta HSD prevents cortisol conversion, leading to cortisol binding to the aldosterone receptors and producing the aldosterone like effect. Okay, hope it is clear now. Moving to the next question. Which herbal drug is associated with hypertensive effect? Which herbal drug is associated with hypertensive effect? Licorice, reserpine, ginseng, ginger. Correct answer is option A, licorice. So we have just now studied about the aldosterone-like effect of this licorice, right? Okay, so when the glyceric acid, okay, it stimulate the mineralocorticoid receptor, it produce aldosterone-like effect. And what is the function or what is the pharmacological action of aldosterone? It can cause sodium fluid retention. Okay, so sodium fluid retention means it is present within the body itself, right? So it is not eliminating out from the body. So the presence of sodium and the water, it can cause increase in the blood volume and finally increase in the blood pressure. That is why the question answer for this question, the herbal drug associated with hypertensive effect is licorice. We have already studied that reserpine is having antihypertensive action. Then ginseng, ginger, all these are drugs having hypertensive actions, but not hypertensive effects. Next question. Which of the below advice is most applicable in the case of ibandrinate? Options. Take with at least 4 ounces of plain water. Take the tablet immediately after breakfast. Remain upright and do not lie down or recline for at least 30 minutes. Take at least 60 minutes before other food, drink, or medications. So the question is about which of the below advice is most applicable in the case of ibandrinate. So the correct answer is option D. Okay, so let us review each of the options one by one. We know that ibandrinate is coming under the class of bisphosphonates. Right. So generally, we used to advise patients who are taking bisphosphonates to administer it with large quantities of water. Okay. And also they need to remain upright. Okay. And they should not lie down immediately after taking the medication. So this is the general advice that we are giving to the patients who are taking bisphosphonates. Now the question is specifically about the ibandrinate. So now we have to think, is there any difference between each of the bisphonates? Okay, there are alendronate is there, ibandrinate is there. So question is about the ibandrinate. Now take with at least 4 ounces of plain water. If this question was about generally bisphosphonate, this option would be correct. But in the case of ibandrinate, this option is not correct. Okay, we have to take with large quantities of water. So this is not applicable here. Now take the tablet immediately after breakfast. No, we have to take it before food, drink, or other medication. Now, remain upright and do not lie down or recline for at least 30 minutes. Okay, so this is applicable if the question is with respect to generally, okay, if it is respect to bisphosphonate. But in the case of ibandrinate, it is not 30 minutes, it is 60 minutes. Okay, and finally, take at least 60 minutes before other food, drink, or medication, which is more appropriate in the case of ibandrinate. And do you know why we used to give patients advices like this, like large quantities of water and do not lie down immediately? Because uh, it can cause esophageal erosions. Okay, bisphosphonates can cause esophageal erosions. That is why we are giving these type of advices to the patients. Okay. So these are the dosing instructions. Okay, take with at least 6 to 8 ounces of plain water, not 4 ounces. Take with at least 6 to 8 ounces of plain water. In the case of risdronate, okay, at least 4 ounces of plain water is fine. Now take at least 30 minutes before other food, drink, or medications. And in the case of ibandrinate, 60 minutes. Now, risedronate delayed release tablet is immediately after the breakfast. Now remain upright and do not lie down or recline for at least 30 minutes for bisphosphonates, but in the case of ibandrinate, it is 60 minutes. Hope it is clear now. Now let's move to the next question. Isotretinoin cause increased insulin resistance, increased WBC and RBC counts, increased HDL, hyperlipidemia. Okay, which effect is caused by isotretinoin? Answer is option D, hyperlipidemia. Okay, so isotretinoin can cause a lot of laboratory abnormalities. For example, it can cause mainly hyperlipidemia, then elevated liver enzymes, then decreased HDL, increased liver function test that because of the increased level of liver enzymes, then increased creatine phosphokinase enzyme, decreased hemoglobin and hematocrit, decreased RBC and WBC count, increased platelet count. So these are the different laboratory abnormalities that is caused by the isotretinoin. Next question. Which suspending agent is added to prevent agglomeration of particles? Which suspending agent is added to prevent agglomeration of particles? Clays, surfactants, wetting agents, hydrophilic colloids. Correct answer is option D, hydrophilic colloids. Okay. Now the question is asked about suspending agent. So you can understand that it is with respect to suspensions, right? What are suspensions? It is a kind of formulation, right? It is a liquid dosage form. We know that medicament we need to administer to the patient, so we need to deliver in the appropriate formulation. So solutions, we know that when certain drugs are dissolvable in water or in aqueous medium, we can dissolve them and deliver to them as in the solution form. But all the drugs we cannot make them solubilize in an aqueous medium. There will be insoluble solid particles will be there. Insoluble solid particles. So in the case of such drugs which is insoluble in nature, we will prepare them by formulating as suspensions. Okay, so insoluble solid particle, we usually combine it with aqueous medium and formulate into suspensions. Now, directly we cannot add this insoluble solid material into water and prepare suspension, because what will happen? This insoluble particle will settle down. Okay, after some time they will settle down. So we have to make it uniform suspension where the insoluble solid particles are uniformly dispersed like this. Okay, so for that we have to add suspending agent. Okay, different type of suspending agents are there. Okay, for example, clays. These are actually example for a suspending agent. Surfactants. These are another category of suspending agent. Now, hydrophilic colloids. These are also a type of suspending agent. Okay. Now, in these three options, that is clays, surfactant, hydrophilic colloids, all these are suspending agent. And question is asked about which suspending agent is preventing the agglomeration of particles. Okay, so the correct answer is option D, that is hydrophilic colloids. So even though all these three are different type of suspending agent, their purpose is different. For example, just like in the question, hydrophilic colloids, they are actually preventing the agglomeration of the particle. Agglomeration means what? Like the clumping of the particles. Now, clays. What is the function of clays? It is actually used to increase the viscosity of the suspending medium. Okay, they are actually used to increase the viscosity of the suspending medium. So the concept is when the viscosity is increased, more time the particles can remain within the medium as suspended or dispersed like this. If the viscosity is low, what will happen? Immediately it will settle down. Okay, so that is not preferable. That is why clays also need to be added, but they are acting as a suspending agent by increasing the viscosity of the suspending medium. Okay, and they can also contribute to the effect known as thixotropy. Have you heard about the term thixotropy? Thixotropy. Okay, so sorry. Okay. So thixotropy, it is a state of that suspension where when it is remained like when it is shaken. Okay, suspending a suspension before administering, we have to shake it. Okay, so patient should be advised that before administering, we have to shake that medicine. Why? Because the particle need to be uniformly dispersed and we have to get it in the easily administrable liquid form. Okay, so when it is shaken, it has to move into the liquid form, and when it is uh, settled in the sense, or when it is keeping in the shelf and all, okay, it has to remain in the gel form. Okay, so in the gel form, its viscosity will be higher and the particles will be in the dispersed form, but it is not easily pourable. Okay, that is known as gel form. So, thixotropy is a phenomenon where the suspension will exist in these two forms based on the situation. So when it is kept in the shelf, okay, when it is remain untouched, it has to remain in the gel form, and before administering, when it is shaken, it will this gel will be converted into the liquid form so that patients can easily administer it. Now, wetting agents. What is wetting agent? Wetting agents are actually a kind of surfactants. There are a lot of applications for this wetting agents. But here in the case of suspensions, why we are adding the wetting agent? Because we are actually adding the insoluble particles with water, right? So suddenly if we add these insoluble particles into water, there will exist a repulsion between this particle. They are not matching, right? Because one is insoluble particle and the other one is aqueous medium. They cannot, remain attached. So in order to enhance the attachment between this insoluble drug particle and the water, we will first add the wetting agent. Okay, when the wetting agent added, what will happen? Suppose this is the insoluble solid particle. It will make changes over the surface of this insoluble solid particle and make it a or give it a hydrophilic nature so that it can be easily made miscibility with this water. But that is not a complete step. That is a first step that is doing when we are preparing the suspension. So after the addition of this wetting agent, we will proceed with the addition of suspending agents, clays. Okay. So wetting agent is also necessary and a very important part in the formulation of suspending agent. But the answer for this question is hydrophilic colloids. So just taking you through the important points in this solution. So suspending agents include hydrophilic colloids, clays, and few other agents. Suspending agents most often used is hydrophilic colloids. Example, cellulose derivatives, acacia, sandal gum. These are examples. So they are used to increase viscosity, inhibit agglomeration, and decrease the rate at which particles settle down. Now, clays, they are actually strongly hydrated and they are responsible for the thixotropy property. Then other agents are also there. Okay. What is the role of titanium dioxide in pharmaceutical storage? Protect from light, protect from decomposition, increases potency, and improves taste. Answer is option A, protect from the light. So we know that some of the pharmaceutical preparation, if it is exposed to light, it can undergo instability or degradation reaction. So that is an example of photostability reaction. So in order to protect it from the light or degradation caused by the light, we will add certain opaque agents. One of the opaque agent example is titanium dioxide. One of the other example is zinc oxide. Okay. Next is a calculation. So question is like this. As per prescription, 2 5 ml spoonful 4 times daily is the dose written by the physician. The syrup comes in a 100 ml bottle. So one bottle will last for how many days? Options 2.5 days, 4 days, 12 days and 5 days? The answer is option A, 2.5 days. So, how to find this out? So, the prescription says 2 5 ml spoonful. Okay, so 2 5 ml spoonful means it is 10 ml, right? And it need to be taken 4 times daily. Okay, so that 10 ml need to be taken 4 times daily. So 40 ml. 40 ml is the dose that is taken daily. Okay, this is the daily dose. Now, what is the total volume in the bottle? 100 ml. And the question asked, one bottle will last for how many days? Okay, so the total volume of the bottle is 100 ml. Question is asked, this 100 ml will last for how many days? So 40 ml is the daily dose, right? So one day, 40 ml. Second day, okay, 40 ml. What is the total volume now? 80 ml. Now on the third day, okay, on the third day, how many volume is remaining? This is 80. Now 20 ml is remaining. That is half of the daily dose. So that on the third day, it is not sufficient. Okay, so that is why the answer is 2.5. So 20 ml is half of the 40 ml. That is why first day, second day, it is complete. And on the third day, for third day, it is not a complete dose. It is half of the daily dose. That is why 2.5 days. Hope it is clear to you. You can just go through the solution, mention the slide as well. Okay. Next question. Which of the drug induced neuropathy cannot be improved by pyridoxine? Which of the drug induced neuropathy cannot be improved by pyridoxine? Options: penicillamine, isoniazid, dapsone, and rifampin. Answer is option C, dapsone. So we have studied that pyridoxine, it is vitamin B6, right? So it is usually used for, there are a lot of drugs that can induce neuropathy. Okay, so this penicillamine, isoniazid, dapsone, all these can induce neuropathy. Okay, rifampin, it is not a drug associated with the neuropathy, but all the other three drugs are associated with the neuropathy. Now, when the patient is having peripheral neuropathy, usually they will be supplemented with Pyridox because when the drug is given, usually vitamin B6 supplementation will be also given to resolve this drug-induced neuropathy. But the common factor with penicillamine and isoniazid is the type of neuropathy is peripheral neuropathy. Okay, it is peripheral neuropathy. So pyridoxine, it is effective only in the case of this peripheral neuropathy. In the case of dapsone, it can cause peripheral neuropathy, but more commonly what you can see is the motor neuropathy. Okay, it is the motor neuropathy. So mainly motor functions, the muscle movements are mainly affected. So in that case, supplementing with the vitamin B6 is not effective. If the patient is showing severe reactions of motor neuropathic symptoms, then we have to stop the drug. Stop the drug is the only effective step at that time. Supplementation of vitamin B6 is not effective there. So the answer for this question, which of the drug-induced neuropathy cannot be improved by pyridoxine, is option C, dapsone. So just taking you through the solution also once again. So penicillamine, you know that it is a drug that is used in the case of Wilson disease. What is Wilson disease? It is a kind of copper poisoning. Okay. It can also be used in the case of cystinuria, and it is also an option for lead poisoning, and it is a drug used in the case of rheumatoid arthritis also. So in all the situations, pyridoxine is used in different doses, but daily supplementation of this pyridoxine is necessary. So pyridoxine is supplemented for patients taking penicillamine. Now, uh, in the case of patients with taking isoniazid also, this peripheral neuropathy is a problem. They are also taking this daily supplementation of this pyridoxine. Now, rifampin is not associated with neuropathy. Only the isoniazid and ethambutol, okay, the antitubercular drugs, these are the two drugs which is associated with peripheral neuropathy. Now, in the case of Dapson, the motor neuropathy is more significant. So, to resolve that, we have to stop the drug. So, in that case, supplementation of pyridoxine is not clinically relevant. Next question. Which type of ADR is tardive dyskinesia with neuroleptics? Which type of ADR is tardive dyskinesia with neuroleptics? Options: type A, type B, type C, and type D. The answer is option D, that is type D. Okay, so you know that different type of ADRs are there, right? Can you say different type of ADRs? So that is type A, B, C, D, E, F. Okay, these are the different types of ADRs. Okay, each of them have different reasons. So type A is known as augmented. Okay, augmented reactions. What is the meaning of the word augment? Increased. Okay, so that means certain drugs, when its dose is increased, it will show certain ADR. Okay, so in the normal therapeutic dose, there is no problem, but when the dose is increased, it will show certain adverse drug reactions. Simple examples, for example, the anticoagulant warfarin. Okay, what is the effect? If the dose is increased, it can cause bleeding. Okay, insulin. If the dose is increased, it can cause hypoglycemia. Okay, now next is B, that is Bisare reaction. So these are not dose dependent and these are unpredictable reactions. Okay, for example, when we are using penicillins in certain patients, it can cause allergy in those patients. So that is mainly type B. Okay, that is unpredictable because not every person is not showing allergy to penicillin. Certain category of patients are showing allergy to penicillin. Now, C means chronic. Chronic means chronic use of certain drugs. If we are using that drug for a longer period of time, it can cause certain ADR. A best example is the hypothalamic pituitary adrenal axis suppression caused by this corticosteroids. Okay, the next D, delayed. Okay, so after using the drug for a longer period of time, after a long period of time, certain ADR will come up. So this neuroleptic, what is neuroleptic? These are antipsychotics. Okay, these are antipsychotics. So tardive dyskinesia is one of the extrapyramidal symptoms caused by the first generation antipsychotics, and this is actually an example for type D ADR. Next, E. E is end of use. Okay, when certain drugs are stopped abruptly or immediately when they are stopped, the patient will start to show withdrawal symptoms. Okay, for example, beta blockers like propranolol, when we are stopping those drugs, the patient will start to show rebound hypertension. So that is a kind of type E ADR. So what is the solution? We should not stop those drugs immediately, but we have to gradually reduce the dose and stop that drug. Next is failure. Okay, failure type of ADR. For example, oral contraceptives. Okay, so that conception, so on the oral contraceptives, if it is used in the presence of certain enzyme inducers, its effect is lost. So that is type F ADR. So in this question, it is asked about tardive dyskinesia. It is kind of delayed ADR, that is type D. Hope it is clear to everyone. So other examples of this type D reactions include uh, fetal Hydantoin syndrome caused by phenytoin carcinogenesis. Okay, all these are different types of examples. Now, the last question. Find the error in prescription and select an appropriate resolution from below. So the prescription says alendronate 10 mg per week, calcium carbonate 600 mg, ibuprofen 400 mg. So options: A. Ibuprofen 1.2 gram, alendronate 150 mg per month, alendronate 70 mg per week, and option D, none of the above. So answer is option C, alendronate 70 mg per week. So in this prescription, so the type of error showing us error in the dosage. Sorry, error in the dose, not dosage, error in the dose. Okay, so 10 mg per week is not the correct dose. 70 mg per week is the correct dose given for alendronate. So ibuprofen 1.2 gram is actually the maximum dose that is given daily. Okay, that is the maximum dose. Okay, and 150 per mg per month, that is not accurate. 70 mg per week is the correct dose for alendronate. So in this table, you can see the different type of bisphosphonates and its corresponding dose that is used on a daily basis as well as on a weekly basis. So in that also you can see alendronate, it is used 70 mg per oral weekly. Okay. So that's all. Thank you.